Welcome to HiNZ 2018. I'm Pat Kerr, and I'm here this morning talking to Dr. Sheng Hong, who is an Ophthalmology Registrar at Dunedin Hospital. Hong, welcome. It's good to talk to you. Now, you're going to be talking to the delegates this afternoon about MedicMind, right, which is an application, the title of your paper this afternoon, Skin Cancer Detection Mobile App, Enhancing Diagnosis with Deep Learning.
Correct.
All right. Can you tell us about that? Of course, you're an ophthalmologist,
Yes.
so there's the whole that aspect of it. But give us the highlights of what MedicMind is.
Thanks, Pat. So you might be wondering why an eye guy's doing a skin stuff, but I think dermatology is kind of something that's quite easy to see and visualize. You don't need special equipment to look at a lesion on the skin. I mean, you do use the dermatoscope, but you could visualize it without like looking at the back of the eye, which is why we picked that as a project for MedicMind. So in summary, MedicMind is an online platform that allows clinician developers or researchers to build their own artificial intelligence, mainly an image-based classifier. So an example would be a skin cancer diagnosis app. So we've created an algorithm that would be able to analyze every single images that you've uploaded to the platform to give you a risk assessment for malignancy. So it's basically telling you or guiding the clinician whether a lesion is looking cancerous or not. And the ultimate sort of use case in this app at the moment is for research. So we're trying to figure out, is computer actually good enough to pick up cancerous looking lesion, just like in the GP practice or in a primary care center, where if you present to the doctor and saying, oh, is this looking suspicious, hasn't been there before, and what makes that decision to biopsy it or not. So we're trying to create a tool to compare its performance to clinicians. Is this going to be something that's usable or something that's useful at all in a clinical practice to help with decision making?
So tell me about where does it get? It's working in the cloud, is it?
Correct.
It's in the cloud, yeah.
So MedicMind is completely cloud hosted, so it's web-based application. Anyone can just go online, register an account. Well, not technically everyone, but if you're interested in building medical images and AI, get an account online, and all you have to do is to create a few categories of bin depending on what you would like to train. So for example, if you like to build a classifier for skin cancers and you're interested in 3 different subcategories of skin cancers like melanoma versus squamous cells and basal cell carcinomas, you could have 3 different folders within the online page. And all you have to do is drag and drop those images that were previously diagnosed by the clinicians through things like histology reports into those specific bins and click run, which would take about an hour to train the classifier. And so within an hour, you get an algorithm that will be able to pick and differentiate those diseases. And it will give you a report of what's the accuracy, sensitivity, and specificity of the algorithm.
Mm-hmm. So has MedicMind been developed here in New Zealand?
Correct. Yeah, so we're based in Dunedin, and we've got a team working on MedicMind. It's currently in an open beta phase, so we're trying to attract researchers mainly from institutions like universities to try the program to see if they could use it for specific use cases. So far, we've got different cases, mainly our projects were in eyes, things like OCT scans, retinal images. We've also got people using it for cervical cancers, gene prediction, using OCT scans to predict what gene you carry just with an image of the eye. And we've got people using it for things like X-rays and CT scans as well.
Mm-hmm. So is there a website available to get information on MedicMind?
Yes. Or? It's www.medicmind.tech.
Oh, that's dot
tech.
.tech.
Yes.
All right. So that's pretty
website.
easy. Yeah. And is the whole team based at Dunedin Hospital?
Correct.
Mm-hmm.
Yeah.
Mm-hmm. And where would you expect to take it? Let's say we're looking forward 6 months, a year. Do you have a plan or a roadmap for where you want to take the application?
We are planning to launch it globally from day one when it's open, because there's practically no barrier in not doing so, I suppose. It's pretty much cloud-based. You can access it anywhere around the world. So we're planning to launch it to all the institutions, universities where they've got a medical arm or a medical team that's affiliated with the universities. So the initial plan is to run it for open beta for 18 months. So we've been doing it for the last 6 months, so about a year to go. Trying to get as many users as possible from different specialty. So far we've got radiology, ophthalmology, pediatrics, and skin. We're trying to expand into pathology, histology as well, and anything that has got images, medical images.
Mm-hmm. And how will the security of the information, where is that going to be managed?
So we've got 3 levels of security. The site is all HTTPS secured, and the informations that you uploaded are protected with Amazon Cloud Service, AWS, and obviously the last layer would be your personal login into the actual system is encrypted as well.
So the hosting, even though it's in the cloud, is going to be still managed by your team at Dunedin Hospital, right?
Yeah.
So once you go, you'll probably need some additional resources once it takes off,
Yes.
won't you? Right.
Definitely.
And will this be a fee-based application?
At the moment, we haven't charged any fees because it's open beta, but eventually, yes, we're planning to launch it as a subscriber basis, where if you were to use it based on head counts and the volume of data that you're going to use for training.
So Hong, thank you so much for telling us about it. Wish the very best of luck, and we'll put the website on with the video clip, as well as your paper you're giving this afternoon will be available to the HiNZ delegates and HiNZ members, and then they can see and listen to you talk about MedicMind.
Excellent. Thank you.
Best of luck with it. Thank you, Hong.
Thank you.